And I want to bring Sneha Mordani live in on this story as well. Sneha, that meeting by the Prime Minister still very much on. Milan, of course, is right outside the Prime Minister's residence. What are you hearing from the Health Ministry and from your sources within the COVID task force? What specific items or action points should Indian citizens be looking out for at this time?
Well, as far as the government is concerned, the worry really is that this variant has been seen, or this sublineage has been seen in the month of July, September, but cases have not increased. So the fact is that given its transmissibility, there isn't enough counting. We're not looking hard enough, Shiv, and that's the message that's going to come from the government, that if you have symptoms, then go for an RT-PCR test, because the positive sample is what is going to be sent for genome sequencing. The focus is going to be on that and not on harder lockdown measures, or forget lockdown, even harder restrictions. That is not something that the government is going to be looking at immediately. The focus is going to be on looking for more cases. Are we not counting well enough to keep an eye on hospital data? That's extremely important. Omicron wave that hit us early this year saw just so many cases, 5 lakh in a day, but hospitalizations weren't of worry, and that is one parameter that they always look at, because the worry isn't really the number of infections, the worry is the severity of the infection. So that is something that the government is keeping a very close eye on, and the discussion also is centered around this. The message is clear. Take precautions if you can, especially for the vulnerable. However, there is no need to go for a fourth dose of the same vaccine that you've taken, because A, there is no data available, and also the uptake of the precaution dose is really poor. Shiv, 28% of the Indian population have taken the third dose, the precaution dose, which is not good at all. And companies like Serum have spoken about the fact that they had to discard the doses because they expired. Production has slowed down. All of these things will be factored in.
Okay, they'll all be factored in, so it's going to go into quite a degree of detail. Milan, what should one expect in terms of procedure after this particular meeting? Am I right in assuming that there's likely to be some kind of advisory, appointed advisory to states in a kind of general sense, asking them to disseminate more information forward?
Yes, Shiv. In fact, what Sneha just mentioned, the government isn't looking at moving forward with any strict restriction or lockdown or any sort of, containment measures at that moment. But yes, there will be a guideline or an advisory that will be issued through the Home Ministry. Of course, that is the DDMA guidelines that we'll be looking at. Through them, they will be implemented in the states, and the states will have to ramp up their testing, their vaccination facilities, so that people can book their slots on COVID, go for their precaution doses. Otherwise, it will be difficult for the state government themselves, because a lot of states, like for example Karnataka as well, has only 20% coverage in precaution doses. So that's also less. And from the government side, at the central level, of course, looking at the international threat of having another mutant in India, especially from countries like China or the United States, where people are traveling, is going to be a problem, which is why this 2% random sampling is being done now at the international airports, and that advisory will also come forward from the Health Ministry, then will be directed to the Aviation Ministry, and then will be implemented at airports across India. So that is one threat, because as we know, BF.4, it's been circulating here, BF.7, but of course India has not seen a rise in cases, while China kept pressing on the zero COVID policy, and they are suffering at the moment because of that. And India has also, Shiv, a very high rate of natural infection immunity at the moment.
Yes.